Welcome to Huron Medical Center. We will never forget why we are here, who we are working for, or the impact we have on patients' lives. No matter what floor we work on or the department we serve, whether we hold a scalpel in our hand or a pen, whether we push a crash cart or a lunch cart, we are part of something bigger, a community, an environment that solicits collaboration, an organization that helps improve lives. We are what makes this place more than a hospital. We are its hands and its heart. We are Huron Medical Center, and we are the patient experience.
Hello, this is Dr. Shalabi. I am a general surgeon and I did a fellowship in colorectal surgery, so I'm also a colorectal surgeon. And I've been here now in the thumb at Huron Medical Center for almost coming up to 2 years. I really like this facility because it is in a rural area, serving the thumb area, but at the same time, the kind of services that are provided here, the kind of physicians and the subspecialties that are available could be found only in large cities, if you would like to say. I worked in big hospitals before coming here. I always lived in large cities, but I always loved rural communities. And the problem is that I always like to continue practicing the same way, and I was actually thrilled to find out that these services are provided here at Huron Medical Center. The robot, for example, is one of the major services that are provided here, where patients could come in, have their surgery, go home either same day or within 2 to 3 days maximum, compared to if you do it laparoscopic or open, patient would stay probably around average of 5 days. The services that the robot could provide, you could see them in urology, OBGYN, general surgery, and colorectal surgery. For me as a colorectal surgeon, I really like to use the robot because when I do a rectal surgery, when I do a colon surgery, patients would stay in the hospital for an average of 5 days. I could cut that for about half, where patients could leave 2 days after surgery. Robot surgery is really very important because it provides safe surgery and it allows the patient to go home earlier because of less pain, and the likelihood of complication is much lower with robot surgery because the surgeon is it's almost like operating under a microscope. Everything is 10 times bigger. So with this magnification, any small blood vessels could be seen and taken care of, so the bleeding during surgery is far less. I always tell my patient when I do this major colon surgery, the blood loss is less than what the nurse at the lab will take from me.
My name is Naeem Heder. I'm an anesthesiologist at Huron Medical Center and also director of anesthesia at the hospital. I work in pain management, and that is one of my areas of interest, and I've been doing so for the last approximately 20 years. Here at the Huron Medical Center Pain Clinic, we are able to provide some assistance with interventional pain treatment modalities. These have been utilized in patients who have failed simple medication use and have not received or experienced any substantial benefit with chronic pain medications that they may have been prescribed up to that point.
A little bit, but you had mentioned to me when I first came in that you see patients on a regular basis, so you develop a relationship with them. Can you kind of maybe share a little bit about that?
Yeah. The patients come in usually once a week, so we start to really get to know them on a lot of different levels. It isn't just their wound. In seeing them every week, we also are able to see maybe things that are going on in their life or their home that are affecting how the wounds are healing. And we find that seeing them weekly, we can also improve how well they do in terms of their wound healing. We've had some patients that have had like the hyperbaric treatment, 40 to 60 treatments, so that's a lot of time that they spend with us.
And you had mentioned they, because of that, the relationship, it becomes more of a family kind of.
Yes,
right?
it is much more of a familial type of thing. They come in with their wounds, and then we end up having so many discussions about so many different things, foods that people are eating, their children, their grandchildren, babies being born. Once they do heal up, sometimes we do miss not seeing them on such a regular basis.
Okay.
Hi, my name is Dr. Robert Much. I'm an OBGYN at Huron Medical Center. Here at Huron Medical Center, we provide full obstetrical and gynecological care. We're the only hospital in the whole thumb providing these services. We also have a full robotics program with robotics hysterectomies. I do enjoy working at Huron Medical Center, especially with the staff and the nurses up in the OB floor. It's a very, very pleasant environment, and the patients are very happy with their care. It's a relatively new obstetrical floor. Mm-hmm. We have LDRPs, which are labor delivery recovery rooms where the patient stays in the same room the entire visit. Very comfortable. They're single rooms. Families are always invited and welcome to stay. The babies stay in the room with the families. They're also they're taken to the nurseries on mom's request only, in case mom needs a little extra rest or a test needs to be done in the isolation room. Basically, delivering a baby at Huron Medical Center is a family-centered environment and a wonderful experience for patients. We get a lot of positive feedback from the patients about the nursing staff, the physicians. Everything about their care has been just top-notch, and we're very proud of that here.
Ready?
Hi, my name is Carl Hayden. I'm President and CEO of Hayden Technology Solutions. It has been my pleasure to serve Huron Medical Center over the last 15 years. Together, we've walked arm in arm to expand services for the patients of Michigan's Thumb. My tenure started out with building the network infrastructure and replacing the old infrastructure with fiber optic cable and Ethernet networking. Over the years, we have implemented a number of projects. All have contributed to Huron Medical Center's goal of better patient service and better health care. We have implemented fiber optic cabling infrastructure between all the buildings on campus, a new hospital information system, and electronic medical record. The system has also introduced current capabilities in billing and electronic medical records. Even a tower located at the back of the campus that reaches all the way to Saginaw. Within the last year, we have improved the wireless network throughout the hospital and installed new computers in every patient room and area. Rolled out improved disaster recovery and continuity services to keep the computer systems running for access to patient data. Implemented the first phase of replacing switchgear to improve network performance and overall system operations. We've also installed encrypted email and secure data transmission technologies. With this foundation, we are able to upgrade the current infrastructure to include a 10 gigabit fiber backbone throughout the campus, This will allow us to build out new services and minimize overhead by converging technologies like voice, video, and data onto the same network, all while continuously working to improve network security, maintain operations, and provide the flexibility to meet the future needs of the organization. All of this has made HMC adaptable and prepared to meet the requirements by the regulatory agencies. It has also put Huron Medical Center in the position of being a leader in healthcare technologies.
I'm Jeff Longbrake, President and CEO of Huron Medical Center. I'd like to thank you all for being here this evening. Looking toward the future, our vision is one of patient-centered care. It's knowing that as medicine continues to evolve and healthcare continues to change, Huron Medical Center remains independent, financially strong, technically prepared, and staffed with superb professionals. In this way, we can best meet the challenges and opportunities that await us and bring healthcare closer to our community.